Welcome to The Exam Room with your host, Dr. Rhiannon Winsor. In this podcast, we explore how value-based care is transforming healthcare for the better. From probing today's challenges to charting innovative breakthroughs, we're here to dissect what's shaping the future of patient-centered healthcare. We wrap up our CAHPS series with a powerful episode on the financial and strategic impact of the patient experience. Dr. Rhiannon Winsor joins Kimberly, Gonzalez, and Sam Reinhard to break down how CAHPS scores influence shared savings in MSSP, signal hidden costs, and shape community trust. This isn't just about surveys, it's about sustaining value-based care. Learn how small improvements in communication, empathy, and perception can translate into healthier patients, stronger reputations, and real dollars. If you're a health center leader wondering whether CAHPS scores really matter, this episode is your answer.
So we're back in the exam room, and I'm joined by Kimberly, Gonzalez, and Sam Reinhard, and we are continuing our conversation about the CAHPS survey. And in this episode, we're going to talk a little bit more about financial and strategic impact. First question for you, how does CAHPS performance tie into shared savings opportunities in MSSP or other value-based programs?
Specifically within MSSP, CAHPS is part of our quality score, and so depending on where our score lies, that determines how much of the shared savings we get to keep. And I think also just another part of that is our CAHPS scores, specifically over certain domains, will act as signals for us on what our patients' patterns are like and what behaviors they have. And so oftentimes you'll see with certain low scoring areas that might directly translate to higher ER utilizations, higher IP flags, all these other things that in turn become high cost episodes. And so there are certain ways that you can kind of look at the scores, not just only for the shared savings, but also what is the cost that the patient is driving.
Yeah, I think when we look at that, we know it's a component of these cost savings, as well as like when we look at value-based care, it's always some sort of component in the formula. So you can't not pay attention. As much as it might not carry the most weight, it's still important, right? Because it's your patient's perception. And so I think every year you kind of see it shift a little bit over how much weight it carries. But you've got to have that buy-in, because I think if you're not paying attention to that and trying to capture as much as you can out of that score, then the other pieces won't follow. And if we're constantly communicating to try to educate you on why closing this measure is important or whatever, well, we just said the more opportunities we have to connect with this patient, the more likely their patient experience is going to improve. And so it's all intertwined. So if you focus on those, the others will follow. When you're focusing on those, remember, you probably have an opportunity to educate the patient in the process, switching them into this better patient perception, which then improves your quality scores overall, which in theory is supposed to yield some incentive money and cost sharing. It's also, to me, it's the pulse checker for us to see. You could maybe close some of those gaps that we think are going to drive healthcare down, but if we're not doing it in a way that patients perceive as great, what's the point? Because we're trying to condition good patients too, and to show them the value of their healthcare.
And I think right there, that's the mindset that a lot of health centers, providers should have around these surveys, is that they're indicator tools. They let you know, okay, how well are we delivering value-based care? Because you'll instantly see it when you see certain low-scoring domains. You'll almost always, if you look at the risk profile of that patient, you'll see, there are tickers and bad indicators of things like ER utilization, or we have some who have reoccurring inpatient admissions. And so that right there tells you that something is not working well on the patient side and there is room for improvement. So like Sam said, I think that's the way you need to think of it. And then the financial incentives will come with that once you start making those improvements.
Yes, absolutely. I mean, it makes sense. You talked about the patient experience before. Patient satisfaction, patient experience. Hopefully that means more patient engagement, which means, they're involved in their health. And then that's going to, have a domino effect into other areas, like keeping them out of the ER or the hospital, or, reaching out to you to get guidance.
They don't see the value in you. You're going to continually chase this thing and you're never going to actually get it. You're not only not focusing on patient perception, you're not focusing on those other components either, because you can't capture any of the value-based components.
Right, and outside of that, it's just good patient care. regardless. Do you think that some leaders of the health centers kind of downplay these results or maybe not take them so seriously? And if you do think that, what would you tell them if they were here now?
We talk about patient perception often. So at least in our health center, we don't see that. And it's very difficult to gauge others because I've only worked for the one FQHC. But I do think once you bring it to the forefront and you really pay attention to those pieces, you'll see it in your patient outcomes because we've really gone all in. And I think if you look at a lot of our quality measures, we've made great improvements over the years. So you're really seeing that value add for the patient, and our patients are healthier because of it. And that's not leaving any of it on the table. That was going all in on every measure, every component. That includes the patient experience and perception portion. You can see it in some of our numbers. When you do that and you're considering every opportunity, a lot of those other pieces you're chasing for value-based care will follow, and they go hand in hand. So you can't leave one on the table. You got to move them all.
And I think for any leader that maybe does have that mindset, is the first thing I would tell them is you're missing the bigger picture. It's not really about chasing a payout. It's about the indicator that the CAHPS survey does tell you, which is how are you delivering that value-based care? And it provides that accountability back to the health center of saying, okay, well, are we taking the patient-centered approach? Are we really focusing on what they're trying to tell us? And where are the opportunities? Because in turn, that's going to create the long-term effects where we have better continuity of care. We have the patient feeling like they have a place that cares about them, where they feel heard, and that creates that retention. That might even in turn create referrals where you might get some friends and family, and that's then increasing your membership. Sure. And it all creates this downward domino effect where you in turn get the things you are chasing within a value-based contract. And so I think that's kind of the way you need to look at it, is looking at this one action might not result in something immediately, but long term I'll reap the benefits of what I'm sowing.
Yeah. And then that kind of pushes out into the health of our overall community health, right? And the economy and those kinds of things. We're saving the world.
That's what we're doing. One day at a time.
Yeah, one day at a time, one patient at a time. Or health centers that are participating in MSSP or other value-based payment programs, is there a specific score they're looking for on the CAHPS?
Yes. With the CAHPS scores, for every domain, you do have a comparison of what nationally other similar organizations are scoring. And so, of course, you always want to be above that percentile. You want to be in the top 90th. And so you always have that as your internal benchmark. But I think there's also always just making those 1-point adjustments. I always like to make small, attainable goals that our health centers can achieve so it doesn't feel too overwhelming. Because you don't want to try to fix every domain that's, showing that they're low scoring. You want to try and tackle those for which are feasible and which ones you can actually do something within your organization. And so that's where I think those solutions that we had provided earlier, the ones where it's low investment but high return, something as simple as, asking the question at the end of the visit of, do you have any other questions? If so, this is where you access us. Or did you know we have a 24/7 line and this is where you can reach it? Providing those little engagement points can sometimes have a long-term effect. And so I think that's kind of what you need to focus on.
Yeah, I would agree. I think they all have their different weights and they all work a little differently whenever it adds this component. So there's not a direct answer for how much weight it carries. I think it's as part of the collective, but you can't not watch it. Over the years, it's something that we've learned, mostly in value-based, obviously, because MSSP is newer. But it's always a piece that carries some weight. We're all really getting graded. And so we got to make sure we're paying attention because it does matter.
And I think one thing also with the score is it's your reputation, your health center, and how the community sees you. And you don't ever want to know that you're scoring poorly.
Right.
You want to make sure that, the work that you're putting in is being received well. And so I think that's also one thing you can just kind of pay attention to is those small changes, whether it's a point change or whether you're making a 10-point change. At the end of the day, that improvement is going to show in itself with the way your patients perceive you. And that in turn creates, a better reputation. You have a stronger hold on the community and you're a reliable source. And especially nowadays with the distrust in the healthcare system, that's something that you're constantly battling. And so I think there's a lot of different incentives to try and improve in your CAHPS scores. I think sometimes with the CAHPS, survey, especially with how many domains it has and how large of a questionnaire it is. It can feel really hard to move the needle. And I know sometimes, especially with leadership, the first question will be, well, how much do we need to invest to move things? And that's the nice part about this, is you can really take it piece by piece and focus on the more attainable targets and what you can do to move the needle, and then kind of work your way through there. And so that's the one thing, is take it one piece at a time. Sometimes small things, just like improving engagement, or having that empathy prompts when your patient is leaving the visit, will help long term. And those are small actionable things that can be implemented in a short period of time and have that long term effect.
I think outside of MSSP, outside of CAHPS, it doesn't matter what it is. If their patients are taking the time to tell you something, you need to listen. Your reputation depends on it. And you went into healthcare because you care. And so it's never losing sight of that. And hearing what patients have to say matters. You have to kind of weigh that with the care you're providing and their perception of it to make sure they continually seek that and they continually seek you. Because I think as an FQHC, we know we care and we know we make a difference. And it's just helping others see that difference that we make.
I think my final thought, and literally I wrote it down verbatim, it's, if we want to succeed in value-based care, we have to build loyalty and trust, and CAHPS helps keep us accountable to that. I think that's my one.
I think that's a great
It's a great ending nugget.
It is. And, Sun Life Health is a shining star.
Well, thank you. We're trying our best.
Thank you so much for all that you do in our communities and for the patients and for being here and talking with us today. And thank you, Kim, as well, for your time.
Yeah, of course, anytime.
Thank you for joining us in the exam room, where we examine the vital signs of value-based care and diagnose what's shaping the future of healthcare. We hope this conversation was as insightful as your last checkup. A big thank you to our guests for sharing their expertise and prescribing actionable ideas. Stay tuned for more episodes as we probe the topics that matter most in value-based care. Until next time, take care, and thanks for listening to The Exam Room.